Welcome to BattleCon 2016, brought to you by C Political. My name is Brad Pomerantz, and we are coming to you from the beautiful Los Angeles City Hall. Election Day around the corner, November 8th. There are 17 measures on the ballot that are statewide initiatives. You've all received this 247-page booklet detailing all the initiatives. If you live in Los Angeles County, you've received this booklet. It's over 50 pages. There's a lot to digest, and today we are going to be speaking about one of those initiatives. It's known as Proposition 52. And it is my pleasure to introduce you to a proponent of Proposition 52 and an opponent of that proposition. Eric Bauman joins us in favor of 52. He is the chair of the Los Angeles County Democratic Party. He is the vice chair of the California Democratic Party. In opposition to Prop 52, we are joined by Jonathan Jake. He is a Southern Vice Chair of the California Libertarian Party. We're going to start our conversation today with opening statements for both the for and against. Don't give away too much, gentlemen. Let's leave something for the audience to enjoy, and then we'll get into a hearty discussion. Eric, give us a sense as to why you are in support of Proposition 52.
Just a few years ago, hospitals and emergency rooms were closing across our state. And the millions of people who are on Medi-Cal had no ability to get care. Today, 13.5 million Californians get care in part because of this program. This program is a voluntary fee that hospitals have charged themselves, which is used to bring additional federal funds into our state and ensure that hospitals stay open and their emergency rooms stay open. This program has made a difference and saves lives, and it has brought an additional $1 billion a year into our state for health care for children by themselves.
Jonathan Jake, why are you in opposition to Prop 52?
Well, the California Libertarian Party is one of the very few groups that has come out in opposition, and the reason is very simple. It's completely unnecessary. We're not here to debate the merits of the hospital quality assurance fee that the proposition concerns. That measure is already in place, and it will most likely continue to be in place regardless of what the voters do in November. The measure is completely unnecessary. All it does is lock in the legislature and makes it very difficult to change the tax and regulation scheme that's in place now. It's bad public policy to tie the hands of the legislature that way. We need to let them be free to act so that when conditions change, and we can be sure that they will change dramatically in the future, we need to let them have the ability to respond quickly.
Eric, let's delve into that question because Jonathan does bring up a point. There is legislation which enshrines what Prop 52 does. What the proposition will do is further enshrine it, deepen California's commitment to it through placement into the California Constitution, which is already the third longest constitution in the entire world. India is the first and the second. I think actually maybe it's Alabama. It's kind of hitting me. I'm not sure. But do discuss that point. Why do we need a constitutional solution?
As a Californian, I want California to be number one in everything. I think we should have the longest constitution in the world, and so we'll start with that point. Here's the thing. This, and by the way, as a Democrat, I don't believe in ballot box budgeting. So I share that sentiment, and I don't believe in tying the hands of the legislature. But this is a critical mission that keeps people alive. And what has happened since this fee was introduced, and let me explain to people, the reason this fee was first created was because when the economy tanked, hospitals were shutting down because the state could no longer afford to fund patient care for patients on Medi-Cal. So the hospitals came up with the idea to tax themselves or charge themselves a fee to have the funds for our state to bring down federal funds to match with them. And what happened twice was that the Department of Finance took those funds and used them for other purposes. And that is exactly what is wrong with the way the legislation currently exists. Besides the fact it has to be renewed every couple of years, because it sunsets every couple of years, you have the problem that the Department of Finance or the legislature can take funds which the hospitals have charged themselves in order to keep themselves in survival mode and use them for other purposes.
So let's talk about rating, because there's no doubt that especially during the recession, we saw the legislature and the governor raid certain funds to balance the budget. They raided a K-12 education, which we're still paying back. And the risk of raid when you're dealing with a federal program is the federal government could say, you know what? If you raid this way, we're not going to give you federal dollars. We need to see those dollars dedicated. We see this with high-speed rail. I mean, this is an issue that is recurring. So how would you respond, sir, to this notion that we need a constitutional protection to avoid raids that could jeopardize health care and lives in the state of California?
Well, that's a slippery slope. If you say that we have to fix everything in place now, then we don't need a legislature. We can just have a constitution. I don't agree that we should have the longest constitution. The California Constitution, as it originally was written, is a very elegant document. I write patent claims for a living. I need to be short.
Are they elegant?
I hope they are. That's my goal. And it's a beautiful document if you read the first few parts, the early parts, and then it just becomes too ponderous and long for anyone to read and comprehend. So this would be another straw on the camel's back. I don't think that alone is the most important thing, but the most important thing is to allow the legislature flexibility to act. Nobody likes being raided, but the fact of the matter is when there is a raid or a reallocation of funds, it's done for important political reasons.
So let me respond with a little bit of jurisprudential elegance. Res ipsa loquitur. The thing speaks for itself. This is about saving lives, and allowing legislators or bureaucrats at the Department of Finance to steal these funds and put people's lives at risk is not something we should be doing.
Wait a second.
There is a simple reason why there is virtually no opposition to this. I want to point out that the Chamber of Commerce and labor unions, doctors and nurses, organizations, more than 1,000 organizations across our state of every stripe support this measure, and the reason is because this has turned out to be an extraordinary policy to help California and to help those 13.5 million Californians who get their health care through Medi-Cal.
I want to get to the opposition or lack thereof in a moment. I want to talk about, though, what Jonathan brings up. You know, you talk about the progressive era. We've had it for about 100 years. Hiram Johnson gave us the ability to draft and bring to voters citizen initiatives. But one could argue, as Jonathan suggests, that this is paternalistic, that this is saying, legislature, you're not big enough to do what you need to do, so we got to enshrine it in the Constitution. Why not give the legislature some discretion? I mean, the Democratic Party has been on record as being a little queasy with this flood of initiatives that really put handcuffs on the ability of the legislature to do their job.
Well, you know, one of the downsides of the progressive era reforms that are found in referenda and initiatives and recalls is that, in fact, almost anybody can get a ham sandwich onto the ballot. And that's why we have a ballot that's 247 pages long. That's why we have 17 ballot measures statewide. But having said that, this is a program that's already proven. This is a program that saves lives. This is a program that there's no disagreement about how it works and how it should work. And what we're trying to do is ensure that for the future, the 13.5 million and growing every day number of people who get their health care through the state can go to a hospital and get the care they need, can go to an emergency department and get their care they need. We have forgotten what it was like less than 10 years ago when hospitals were shuttering up and down our state.
I want to talk about the campaign that is in support of Sure, why don't we do that? Absolutely.
Yeah, this measure is not about saving lives or hospitals. That's just completely not true. You don't need to be afraid to vote no. Those programs are already there and already in place, and since everyone supports them, they will not change if this measure fails. That's just the reality in California today. There are proper uses of the initiative process when the legislature is politically unable to take care of important problems. The population can sort of force them along. This is not one of those situations. When you have everybody in the legislature supporting a program, it's a time to get skeptical and say we don't need to enshrine this in our Constitution.
But wait a second. Let's talk about that, because this initiative does have tremendous bipartisan support. the California Democratic Party, the California Republican Party. You have leadership, both Democrat and Republican, in support. The leader of the Republicans in the Assembly, Chad Mays, supports. The leader of the Republicans in the Senate, Gene Fuller, supports. You have the leader of the Democrats in the Senate, Kevin DeLeon, in support. Is the Speaker in support? Speaker Anthony Rendon is in support. It's not very often that you have the Big Four in support of anything, but we do have the Big Four in support of Prop 52, and virtually every single newspaper up and down the state in support of Prop 52. I mean, I'm looking at Republican Mayor of San Diego, Kevin Faulconer, Republican Mayor of Bakersfield, Harry Hall, Democratic Mayor of Sacramento, Kevin Johnson. You don't see that very often.
I'm sure those are all fine people, and I respect them for the jobs they do. But in this case, I'm not afraid at all to be the dissenting voice. First of all, hospitals, nobody can tax themselves. Think about that statement. It makes no sense. You cannot tax yourself to receive funds. That's just logically impossible. Somebody's got to pay for this tax, and it is a hidden tax, and this is why politicians love it so much. It's the San Francisco Chronicle reported it. It's equivalent to $125 to $600 and some dollars per night per hospital bed. Somebody has to pay that. And the answer, who ultimately pays this, are the middle-class consumers that today are getting so slammed by insurance premium
So wait a minute, hang on a second. I'm a registered nurse who spent many years working in emergency departments, intensive care units, and trauma units, and then went on to run hospitals. I know a little bit about how this works, and you're absolutely wrong. What is right here is that lives are saved because emergency departments are not closing. Hospitals lose on every Medi-Cal patient every day they're in there. They don't make a profit on Medi-Cal patients. They barely get 61 cents on the dollar of cost. But this program has done wonders to make our healthcare system solvent in California. And when you see the Republican Party and the Democratic Party in California come together on a measure, you know that there's got to be something that works. When you see the California Chamber of Commerce and labor unions all across our state come together, obviously this is something that works. And that's why we have it, and that's why we need it.
And let me ask you, though. We're learning a lot about the Libertarian Party as a result of this election cycle. So I want to get a sense, what's the Libertarian Party's concern with this measure? You know, when I think about the Libertarian Party, I think about a party that kind of wants government off our backs. Help me.
Well, I can only speak for myself as a libertarian, but I've already expressed my primary concern is this locks in a program that may be completely inappropriate in the future. But I've obviously touched a nerve, but he hasn't been able to explain how hospitals can tax themselves. This is, in effect, a hidden tax on middle-class consumers of health care and health services.
Is this a
So the days, let's be clear about hospitals, how hospitals bill today. You know, 50 years ago, if you went in and the hospital billed you $100, they got paid $100, or if you had an 80-20 plan, they got paid $80, and you had to pay the other $20. In those days, what things cost was a basis by which hospitals got reimbursed. It has been many, many years since it's worked that way. And revenues for hospitals are remarkably low, especially in California, for what it costs to provide care. When a hospital takes away from the little funding that they have, and remember that most, especially nonprofit hospitals, always run at a loss, they are giving something up. And I want to point out something very unique and very important about this program. While every hospital in California benefits from it, small, rural, and what are called critical access hospitals don't pay into it, and public hospitals don't pay into it, but they receive the benefit of the program.
Is this a hidden tax, Eric Bauman?
Anytime anybody's charging a fee on themselves, one could call it a hidden tax. But you have to have a basis. It's not like selling a candy bar at a grocery store. You can't mark it up 5% because Blue Cross is not going to pay you an extra 5%. HealthNet is not going to pay you an extra 5%. And nobody pays cash value out of their pocket.
In the final analysis, we do have a need for these funds. It is undeniable. And with the Affordable Care Act struggling a bit, maybe not so much in California, but nationwide, do we want to be tinkering with the system that is just finding its sea legs?
Well, I'm not advocating tinkering. I'm advocating not tinkering. I'm just saying let the legislature do the job. I think the hospitals do need funds. I think there is an immediate need to fund Medi-Cal. I don't disagree with that. I'm just saying conditions can change dramatically in the future, and we don't want to lock in a very imperfect solution today. I don't think anyone will argue that it, in fact,
And
Eric himself was arguing
and
this
let me
problem.
ask you-
The good news is that in California, it takes a simple majority to change the Constitution. So just as we can change the Constitution today, we can change it again in the future. This measure provides consistency and a guarantee for hospitals that have to be able to plan years into the future.
I do want to ask, we do know the Affordable Care Act is hitting a bump. I think that's fair to say. Not so much in California, but nationwide, especially in states that use healthcare.gov because they haven't adopted their own Cover California counterpart. So even though it is, I guess, arguably easy to change the Constitution, we do have to have an election, and whatever may happen on November 8th, my guess is the Affordable Care Act will be tinkered with at some level. So do we want to enshrine this fix?
But this is not about the Affordable Care Act. No, because you see, what you're doing is you're conflating things together. We had, before the Affordable Care Act, 12 million people on Medi-Cal in California. And at the time when our hospitals were shutting down and our emergency rooms were shutting down, there was no Affordable Care Act. So the Affordable Care Act is a layer on top of this that is not germane to this.
But we do have the Medi-Cal expansion, the expansion. So we have more people using the system, a success story, arguably, with regard to the Affordable Care Act. I understand, and I'm not trying to conflate.
But you are.
But I do want to just kind of dig into this and disabuse me if you need to. Is enshrining this putting potential fixes to the Affordable Care Act at risk?
The Affordable Care Act is a federal program, not a state program primarily. It is one that is implemented in part at the state level. Fixes that would occur to the Affordable Care Act either would be federal pieces or there could be state pieces, for example, to our Covered California program, to our version of Medi-Cal. But here's the reality. We had 12 million people who were getting Medi-Cal when this problem arose. That's what I want to point out. We enacted this program legislatively initially when there was no Affordable Care Act. So even if you'd stripped away the people who've been added to the system, who, by the way, are low-income, hardworking Americans who live here in California. Even if you strip them away, we go back, we revert to the same program. What people don't necessarily understand is that Medicaid, which we call Medi-Cal in California, is a mixed program of federal and state funding. And as it relates to hospital care, it's a matching program. So what the state puts up, the feds match. Mm-hmm. And that's what this guarantees, is that match. And I want to just point out, in case I didn't say it before, in this process, the hospitals put up $4 billion. $1 billion of that is taken by the state to provide health care for low-income children and other kinds of health care and health promotion programs for them.
Final statement from Jonathan and final statement from Eric.
Okay, well, I just want to say nurses are some of the finest people I know. Eric, I appreciate what you've done, and I want to say I'm very proud to say my son is in the nursing program at USF.
Congratulations.
So I'm certainly not against hospitals and nursing in that fine tradition. I want to address just one point about removing this measure in another initiative if it turns out to be not such a good idea at some point. That is true, but the problem is that the hospitals are funding this measure and they're supporting it because it guarantees them an income stream. So who in the future is going to go up against the hospitals, the politicians, the California teachers, the nurses, and who in the future is going to put money down to try to get this off? I don't know. I think the legislature is perfectly capable of keeping this funding mechanism going for as long as it's needed, and I would and they get paid to do it, and they should do their job.
Final comments, Eric Bauman.
You know, I want to just say for our audience, one thing you have to think about at the start of this, hospitals, unlike other businesses, don't get to turn patients away. So whether there's money to pay them, whether there's resources to provide the care those patients need, under federal law, they must provide care to anybody who comes in the emergency department who is ill. This program ensures that our hospitals are not shutting down and our emergency rooms are not shutting down. This program works. We've proven it, and this extends it and makes it a permanent program in California. And that's what we need to keep 13.5 million people healthy.
And I want to thank Eric Bauman, Chair of the Los Angeles County Democratic Party, Vice Chair of the California Democratic Party. I want to thank Jonathan Jake. He is with the Southern California... Southern Vice Chair of the California Libertarian Party, Nate Kaplan from C Political. Thank you so much for joining or inviting us to be here. My name is Brad Pomerantz with Charter Local Edition. This is BattleCon 2016 from Los Angeles City Hall.